Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com, Sage test to detect Alzheimer's and dementia. If you're concerned about your memory or that of a loved one, you might want to take the self-administered Cognitive Exam, SAGE. The test was developed by researchers at The Ohio State University Wexner Medical Center as a tool to detect early signs of cognitive, memory or thinking, impairments. It can accurately identify early symptoms of Alzheimer's and dementia. /r/n/r/n Sage is a self-administered test available online. It has been scientifically evaluated in comparison with other common dementia tests and has been found to be an accurate tool to identify signs of memory and thinking impairment. While not meant to replace a clinical assessment, the Sage test can be helpful in identifying cognitive losses earlier, when treatment may be most effective. /r/n/r/n The Sage test contains a series of questions that measure cognitive functioning. There are actually 4 different tests to choose from, and they are all interchangeable. If you took all 4, you only need to take one. You should score essentially the same on each test. /r/n/r/n The different options are available to reduce the chances of inaccurate scoring that can result from retaking the same test too frequently. /r/n/r/n Here are examples of 3 questions you might encounter on the Sage test: /r/n/r/n Unlike other tests that charge a fee per use or require significant training for those who administer them, the Sage test is both freely available and user-friendly. It can be taken in as little as 10 to 15 minutes, although there is no time limit. /r/n/r/n It's available online and in print versions you can access by going to the Ohio State University Wexner Medical Center site. You can take the test at any time on your own, or it may be administered by a healthcare provider. /r/n/r/n The Sage test measures /r/n/r/n There is a maximum score of 22 on the Sage test. Researchers suggest adding 1 point to the score when the participant is over the age of 80, and another point if the participant has fewer than 12 years of education. /r/n/r/n Sage test scores are considered an accurate indicator of the symptoms of dementia, suggesting that the Sage test is a reliable instrument for detecting cognitive impairment. In studies, it compares favorably with the Mini Mental State Exam, MMSE, a standard exam for testing cognitive ability that must be administered by someone else. /r/n/r/n In terms of accuracy in diagnosing dementia, the Sage test has higher sensitivity than the MMSE, 95% versus 90%, as well as higher specificity, 79% versus 71%. /r/n/r/n Sensitivity refers to a test's ability to correctly identify a disease, while specificity refers to a test's ability to correctly identify those without a disease. /r/n/r/n Certain conditions may affect the test, such as the language in which it is given or a medical issue like delirium. /r/n/r/n After taking the Sage test at home, it's important to bring a copy to your healthcare provider for evaluation. While the Sage test does not diagnose any specific condition, the results can help your healthcare provider know if further evaluation is needed and provide a baseline score to compare with future scores. /r/n/r/n Healthcare provider evaluation is recommended for anyone scoring below 17 points on the Sage test. /r/n/r/n Anyone can take the Sage test free of charge, whenever it's convenient. The test can be downloaded online. /r/n/r/n The highest possible score on the Sage test is 22. Add 1 additional point if the person taking the test is 80 or older, and 1 point if they have fewer than 12 years of education. /r/n/r/n Scores between 17 and 22 are within the normal cognitive range, 15 and 16 suggest likely mild memory or thinking impairments, 14 and below indicate a more severe memory or thinking condition. Healthcare provider evaluation is recommended for anyone scoring below 17/R/N/R/N. The SAGE test is a convenient way to assess your cognitive function if you are concerned about your memory, word-finding abilities, or other cognitive skills. However, it's important to show your healthcare provider your results so that they can be interpreted accurately. /R/N/R/N Early detection of cognitive concerns can identify possible reversible causes of forgetfulness and also allows for earlier and hopefully more effective treatment if dementia is present. /R/N/R/N rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.